Hi, I'm Dr. Jose Joglar from the University of Texas Southwestern Medical Center in Dallas, Texas. I'm the chair of the 2023 guideline on the diagnosis and management of atrial fibrillation. Let me introduce you to the vice chair, Mina.
Thank you, Jose. I'm Mina Chung. I'm a cardiac electrophysiologist at the Cleveland Clinic.
Catheter ablation now is upgraded compared to prior guidelines. I don't believe that medications are that effective based on the evidence. So catheter ablation becomes a more important intervention.
There's still a role for medications, but I think you'll see from this a lot more guidance in terms of early catheter ablation in some of those populations like that you mentioned, including heart failure.
So we also have a specific chapter devoted to the population with heart failure, which is a very critical population because it's especially prone to having adverse events, hospitalizations for heart failure, higher incidence of admission, stroke, mortality even. So we have a whole chapter dedicated to that population. We have evidence to support a variety of interventions. So what do you think about focusing on that population?
I'm glad we did that. There's a lot of, as you say, we have a lot of randomized trials in that population. We have Castle AF. There's Cabana, which showed some significant benefit in patients with heart failure. There's pretty strong evidence base for it. And I think that upgrade, maybe you want to talk about specifics of the upgrade.
So now we are recommending catheter ablation on populations who are most likely to benefit, like the paroxysmal patient with fewer comorbidity, to a class 1 recommendation. You don't have to go through months or weeks or years of trying medications, pharmacological treatment first. The fact is many patients might need both. That's a fact of life, but what we're trying to recommend is to be more aggressive, to prevent, like I said, disease progression, but also the fact is that this guideline is a document that is created based on the evidence. We create this, the writing committee meets, looks at the evidence together, and we decide what is the best evidence. And that's the way we write recommendations. The fact is ablation seems to be superior to medications when it comes to AFib recurrence, isn't it?
The level of recommendation is also based on risk versus benefit. And I think catheter ablation has become safer over the years. So I think that came into play as well.
And medications, not only they're not that effective, but also they have side effects too.